What's up, guys? It's your boy Miguel here to give you your daily dose of radiation. In today's video, we are covering what it's like to have students on their trauma rotation at the hospital. So to give you context, I'm a night shift Xray tech, been doing it for over 4 years. And I work at a trauma 3 ER. So every year, about, I would say twice a year, I believe it's like during the May and during October, we get the next generation of students from the college I went to. They come and do their little trauma rotation, which it's not really trauma like the nurses do. The nurses do a full overnight. Ours is from like a 2 p.m. to a 10:30 p.m. type of shift. They'll come in and they'll get stuff situated at night. But all the funsy stuff comes in usually midnight, and usually when they're gone. All the crackheads and all the other mischievous events that happens in our city come awake. Even on the weekends. On the weekends, sometimes you get more of the, as I call it, the NPCs are doing stuff out in the world, not staying at home, having fun, I guess, and getting hurt. And now it's my problem. But anyways, overall, they come in. They dabble a little bit with the day shift crew, and then we come in at the 8 p.m. mark, and then we kind of take over the joint, and we put it into night shift mode, dim everything, and usually the students, depending on, they kind of fall in different categories. Some of them have more experience than others. Other ones, because it's nighttime and it's different people, because there's a big difference between the people that come in during the day versus the people that come in at night. We got a lot more homeless and a much more different customers come in during the nighttime. Because sometimes I remember students will be with me and they're like, I want to comp this. And then they go in there and it's like a homeless person, or it's like someone that looks a little intimidating, and they'll look at me and I'll be like, I got this one, don't worry, I'm certified. So there's always that. But most students do too. I always ask the same questions of how do we do it, because at nighttime, for the regular people, working overnight is something that seems very intimidating, something that seems very hard, because they're like, how do you do it? Are you like this all night? Are you struggling? How do you sleep? You get asked the same little questions all the time. But the biggest one that's always asked amongst our people always is, Miguel, do you take naps? And to you, I always tell you, I can't confirm nor deny that statement. But it all really comes down to who's the doctor. Certain doctors, once again, can't confirm nor deny the naps at the job. But overall, the workflow is a little bit less, a little bit more chill. But sometimes we will literally get slammed, and the students are like, "Yo, we weren't this busy during the daytime when we came in." And I was like, "It is like that at night sometimes." I would say like once a month, you get slammed pretty bad. Sometimes we will literally be working hard and we'll look at the student and we're like, thank you for your service, because you helped tremendously with our workflow. So always appreciate the students. Sometimes it is more of a chore. Sometimes it's literally like having a third tech and it helps tremendously. Other times, once again, your students, you don't know, you're still trying to learn, or you're gauging how we work, because the workflow or how we get stuff done is completely different versus how the day shift people do it. Because they're always like, hey, you do everything portable. Usually day shift wants to bring it back and shoot it back here. And I'm like, yeah, you would think that, but sometimes it's quicker and more efficient if we do it this way, because now, instead of having to shimmy the patient back to the room, we can just move on next door and keep it pushing. And push the button more and just, operate in different, it's just different workflow that happens. So, usually by the time they come to us, they're already been at other clinical sites, so they're not like brand new techs. So they already kind of get an understanding of it. Some of them have already been at our hospital, so they already know how everything works. Other ones, it's their first time ever being at our establishment, so they don't know a bunch of stuff, which is cool. You know, always willing to help people and educate them and show them what it's like. I would recommend anyone who's in our profession coming in, or even if you're a current tech and you're like, should I do nights, Miguel? I would at least give it a shot one time to see how your hospital or wherever you work with, because there's nothing better than can't confirm nor deny naps, or having a very chill night and you really didn't have to do anything and you got paid to just sit there. Which now at our hospital, the workload has increased more and it is a little bit more heavier than it was before, but still it does not compare nothing to day shift. And like, you can go home and you can literally, if you're willing to give up sleep, you can go do whatever you want, whatever your little heart desires. Take care of appointments, take care of like regular people stuff. And you won't even have to miss out work. So it works out good. I mean, I have 2 little gremlins back here. Anything happens, if they're sick or appointments, I just take care of it. So it does come with some benefits on that side over there. But I would recommend anyone doing it just for a little bit, just to get, you know, dip your toes. There's some people where they can't do it at all, or they try and they end up falling asleep. We have that during the little holiday works where you have to work with a day shift and they come to nights. Sometimes they'll be struggling a little extra hard. But overall, that's all I got for you. If you're new to the channel, I welcome you to the world of radiology. You can check out my channel. I literally post aspects of everything you can imagine. Some people don't talk about this on the channels, on the YouTubes, on the internet. You really shouldn't have to be paying for none of this. I will never charge you for none of this information. You shouldn't have to pay anyone. I think it's all should be for free. I will never charge you. And if you want some humor, check out the link below. I have my TikToks where I do the memes. But yeah, it's been your boy Miguel. We'll see you on the next one.